You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You and Your Young Child has been brought to you in part by Minor Family Dentistry. Minor Family Dentistry would like to bring you the following dental health tip. It's recommended to have a dental checkup no later than your child's first birthday. An adult should brush for a young child and monitor older children's brushing to ensure a good job is done. Flossing should start when teeth are touching. Minor Family Dentistry wishes you good dental health. Families, including children of all ages, are welcome. Minor Family Dentistry, 1010 Downing and Hayes. Find them in the Next Tech directory.
Hello and welcome to You and Your Young Child, the program devoted to early childhood. My name is Dana Stanton and I'm the coordinator of the West Central Kansas Smart Start Grant. And with me this morning is Dr. Heather Harris. Good morning, Dr. Harris.
Good morning.
And we also have someone who's going to help us. We have Blake. Good morning, Blake.
Good morning.
Say good morning. He would say good morning, but he's ready to get started. Now, today we're going to talk about well child visits, well child exams. But first of all, tell us a little bit about you, what you do, and your qualifications.
My name's Heather Harris. I'm a physician over at Hayes Family Medicine, and I treat children, from young children all the way to adults.
Wonderful. Now, when is the best time for baby's first visit to the doctor?
That depends. It can be anywhere from the first day after they're born to up to 2 weeks. It depends a little bit on how the delivery went and how the baby was growing after they were discharged from the hospital.
Now, after that, how often are well child exams recommended?
Typically, we see them definitely within the first couple of weeks of birth, and then they will be seen at 2 months, 4 months, 6, 9, a year, and then they'll do 15, 18, and then at 24 months.
Okay. Now, as a new parent or even a parent of, I have 3 kids, I always wonder, how is my child growing? Are they growing at the right rate? How do you know if your child is growing and developing as they should?
At every visit, they will weigh the child. We will see how tall they are, and we'll see how big their head is. We'll measure what we call their head circumference, and then we'll plot that on a chart, and then it will be based on their growth proportions, and we'll see each time if they're growing in proportion the way they should be.
Now, are there certain questions that you as the doctor might ask a parent at each visit?
There'll be lots of questions. The first visit will be lots of questions in regards to how your pregnancy was, any family history, different questions if you have pets or smoking in the family. And then at the other visits, as they become to get older, we'll ask a little bit on their developmental processes of are they sitting and rolling over, how they're eating, what they're eating, how many diapers they're using a day, if they're starting to do some toilet training, what kind of babysitting, or if they stay home, any illnesses they may have had.
Now, what kind of exam is performed at each visit?
During the exam, we'll see the kid each time. We'll check them out from head to toe. This will include looking in their ears, listening to their heart and their lungs and their abdomen and their skin. And as they get older, we'll ask them to do also some, if they can balance on one foot or do some jumping and some other developmental sort of exams as well.
Now, any particular procedures that you might do?
They'll, at almost every visit between the first 2 years, the majority of them, they'll receive immunizations. And then at 1 year of age, they'll receive some blood work, a lead and a CBC. And then at the very first visit, within the first 2 weeks, the doctor will go over their hearing screen and their newborn screen that they had done at delivery.
Okay. Now, when I leave the appointment, what will I have learned about my child?
Hopefully you'll have learned if they're growing well and if they're on task for their development. And then we'll also talk about things to look for in the future, different feeding procedures that will occur when they move to cereal, when to move to foods, when they can move to more solid and whole people foods, when you can change from formula to whole milk or breast milk to whole milk. We'll talk about safety things, car seats, where it's sleeping positions. In the summer, we'll talk about sunscreen, water safety. Toilet training ideas, some discipline, things like that.
Now, when is the best time to choose a physician for your child?
Most likely probably in the last few months of your pregnancy, you want to start considering the local physicians in your area, anywhere from a pediatrician to a family physician that would meet your ideas of personality and things that you would like to see in your physician.
Now, what is the importance? Why should you have a well child check for your child?
It's important to make sure the child's growing well and that if there's any health concerns that could be picked up early, that could be treated and so it would become a bigger concern down the road.
Now, you've brought some stuff for us,
Yes.
some instruments. I guess
Yes.
stuff isn't the
That's right.
appropriate word. So you can maybe show us
Yep.
some of the things that might happen, and Blake is going to help us.
Yep, that's
So
right.
we're going to let
That's
you
right.
go to town here.
Okay, what we'll do is when the child first would come in, we would take a look at his eyes. So we'll look at Blake's eyes with the light, and we'll make sure that that he's seeing good. As they get older, we'll actually even have them look at the eye chart. And then we'll look in their ears. Can we look in your ears, Blake? And we'll make sure that, and also this will also contain, and we'll ask the parents if they're hearing well and if their speech is developing right.
Hello.
Actually, it's a little red. And then we'll also look in their mouth, won't we, Blake, and make sure that they're brushing their teeth, because that's something important too, that we're doing good dental health and that their throat looks good. And we'll listen to his heart and your lungs, won't we? And we'll feel your neck, and then we'll feel your belly. We'd have you lay down and we'll feel your belly, right? And during most exams, the child would be probably unclothed with a gown for most well exams, and we'd look at their skin and we'd make sure that all their joints are moving well and that they're growing well.
Wonderful. Well, thank you, Blake, for helping us. Now, if someone wants to schedule an appointment, would they need to contact their own doctor?
That's right. It would be good to set that up, make sure that you're staying on, we don't want to get behind, because there's a lot of immunizations to give, and we want to make sure that they're growing at all those right intervals. So yeah, contact your own physician and get it scheduled so that you can stay on track and make sure you're having a healthy kid.
Wonderful. Thank you so much,
Thank
Dr.
you.
Harris.
Thank
You, Blake. You've been watching You and Your Young Child, the program devoted to early childhood. And parents, remember, you're your child's first and best teacher. Thank you.
Thanks for watching You and Your Young Child, a program of information and services available for you and your child from prenatal to age 5. You can watch the program weekdays in the noon and 9 o'clock hours. You and Your Young Child has been brought to you in part by Minor Family Dentistry.